All right, well, I'm going to walk around a little bit because that's just a little bit more my style. It's so good to be with you today. I'm, so happy that I was invited to speak to you guys today, and hopefully you can learn something. This is a picture of me 4.5 years ago on the sidelines of the Cleveland Browns. I was an assistant team physician as a part of my fellowship. That's right, buddy. This game did not end. This game ended in typical Cleveland Browns fashion with a loss, as a lot of them did. There was maybe a solar eclipse, but there were very few things cooler than watching Odell Beckham Jr. catch a ball running 22 miles an hour, trying to beat the free safety to the end zone, and you're 2.5 feet away. Or watching Nick Chubb make a cut up the field and run over the linebacker, and you felt the contact. You didn't just, sometimes in the stands you can hear it, sometimes on TV you can hear it, definitely see it. You felt it. It's like a compression wave. Very few things, again, maybe solar eclipse, cooler than that. But what was just as cool is the sophistication of the healthcare provided at that level. And anything and everything that could possibly be done to get these players on the field was done. We looked into everything to get them back because so much was at stake. $100 million contracts were at stake. And I was really excited to start my practice and take an NFL Browns level, healthcare experience to my patients. And my wife, Jacqueline, is here. My wife and I had several offers for different places around the country. And when we were trying to make our decision, I got a phone call from this guy. So to me, this is Johnny, my brother. To most everyone else in Utah County, this is Dr. Edwards, the neurosurgeon. And my brother had started his own practice, Summit Brain and Spine at that point. They hadn't added the orthopedics, spoiler alert. And he's like, Gary, come join my practice. And I said, why would I do that? There's no orthopedic surgeon there. You're one provider. That seems super risky. We talked a little bit about risk. And he's like, you have to do it. Come do it. So I did a little bit of research, and I found out basically what we were trying to do has completely fallen out of favor over the last 40 years in medicine. And it was 2020 at that point, and during the pandemic, it seemed like a horrible idea. So I saw this article about 3 months before I started my practice, and it talked about practices going to GoFundMe to pay overhead. So I called Johnny and I was like, I don't know. Maybe we should take one of these other jobs. Jacqueline definitely wanted to take one of the other jobs. And he's like, look, I think we have one shot. We've always kind of wanted to work together. I think we have one chance to do it. And I said, okay, let's ride. So it's a picture of me and my brother in 1984. We've always been going places together. I thought, hey, I think I'll always regret it if I don't take this opportunity. But I kept coming back to, Johnny, how are we going to compete with major healthcare organizations and, hospital systems and physician groups that are in the dozens? How do we compete with that? And I think the other thing that was kind of interesting is healthcare is so demanding. Business too. The patients, your clients, they're so demanding. They want a McDonald's level speed and efficiency. They want Tesla level technology, innovation, and maybe even environmental conscientiousness. They want Four Seasons level hospitality and comfort. And then they want Berkshire Hathaway level results and performance. Oh, and also it's surgery, so patients want to also experience no pain. It's like, how do we take on this monumental task of starting a practice? Nobody's here, there's no one to help us. It felt a little bit like backtrack. Felt a little bit like it's just us. How do Gary and Johnny start, a practice to compete with these? And we came up with several ideas that are kind of, I think, the foundation of our business. One is we needed to make a practice about the patients, and that had to come first. We needed to spend most of our time and energy on the most important thing. No one taught me better than Jiro Ono. And maybe it's that Jiro means second son in Japanese, or maybe it's that I'm obsessed with sushi. But if you haven't seen this documentary, you should watch it. This guy is awesome. He's the first 3 Michelin star rated sushi chef ever. He is considered by basically everyone to be the greatest sushi chef that has ever lived. He spends almost all of his time, as the documentary shows, focused on the sushi. Here's a picture of his restaurant. It's not glamorous. It is 10 seats across a bar, and it has 3 Michelin stars. If you're not familiar with the Michelin star rating, basically what that means is it's worth it to fly to Japan, to go to his restaurant, to get back on the plane and fly home. That's how good it is. There's no marketing here. There's no, focusing. It's all about the sushi. And we needed to make a practice that was all about the patients and their outcomes. This is an OR, a place my PA Carolyn and I are very familiar with. This is what it looks like right before a surgery starts. This is what it looks like a half an hour in. Between here and here, as anyone knows, there's so much complexity here. There's so many people that you rely on. You have to surround yourself with the right people. You can't get to this stage and not have something that you need, not have everything prepared, have leaned on someone that has given you bad information. You have to make sure they're healthy. You have to make sure their primary care doc knows that they're not going to die of a heart attack on the table. You have to have the implants there. You have to have everything prepared. We took care of a college soccer player. This is his CT scan. You probably can see that this here is not like this here. This college soccer player had a little piece of his socket that had kind of broken off. And the options were to open up his pelvis or to do a scope procedure and get a small screw in there to stabilize the piece. It would be a much better recovery for him if we were able to do the latter. And so I reached out to a bunch of the reps around the community. Some people don't know that in surgery you have a rep. Anytime a screw or an anchor or a plate or a device goes into a patient, there's a rep there that sells that knows the ins and outs of all of the device specifications. And I was brand new in my practice. I think this was like the 5th patient I had operated on. And I reached out to several device reps to try to get an answer for a specific type of drill bit, a specific type of screw, and a specific type of solution. And all of the companies that I used and were familiar with in fellowship didn't answer my call. And one of them said, "I don't know, Dr. Edwards, I'm not sure I'm the right guy for you." And then I called this guy. This is Jonathan Godbold. I said, this was probably the 5th rep I called. I said, "Jonathan, this is my problem." And he said, this is our text conversation. He says, "I will have it. I will order it now." And he said, I was worried about him. I called him later. He's like, "Gary, if I have to fly to Cleveland to grab this screw, drill bit, and everything, I will fly there." And I was like, this is the guy. I call him the Millennium Falcon of reps. He may not look like much on the outside, but he's got it where it counts. And I think that that's one thing that we learned is we had to surround ourselves with people that have it where it counts. And some of our hardest personnel decisions have been sometimes when you love a member of your staff or a team, some of the hardest decisions we make is sometimes they're not the right person, they're not the right member of the team. This is just a little video of the surgery. Again, if you missed it, it's hard to point on all the things, but if you missed it, there's the little fracture piece, there's the little piece there. Then I'm going to show a video of the scope. So as I'm pushing down here, you can see that fragment move. That is not viable for a stable hip. That's moving all over the place. We got to screw across that piece using a very sophisticated drill bit. There's the screw there, and as I'm pushing on it, it is completely stable. I called him to get permission to show that video, and he said he's doing awesome and said thank you, thank you, thank you. So one of the fun parts of surgery. In case you were under a rock for the last 6 months, this is Andy Reid. There you go. Go Chiefs indeed, except for when they're playing the Browns, of course. In case you didn't watch any of the Taylor Swift, Travis Kelce debacle and don't know who, this is Andy Reid. He's one of the, most everyone agrees he's one of the top 4 NFL coaches of all time. He's considered an offensive genius. He also has a reputation from getting his offensive plays from literally anywhere. He's not above getting advice from anybody. I listened to this podcast that talked about where he gets his plays from.
Look everywhere, though. High school, college. I mean, at least I've heard rumors that you've got guys that go down to the bottom of the ranks to find new concepts and things you might want to go with. Have you ever actually taken something from high school?
Oh, absolutely. Yeah. I took one from a janitor one time at Green Bay. I mean,
No, wait, you got to tell me this.
Well, no, we had a janitor. It was a mom and pop group that cleaned our facility forever, and then they worked game day. And, this guy kept telling me, he was the owner of the company, the father of the family. And he goes, I've got this play for you. And he kept telling me this over and over. Finally, I said, okay, here's a card, draw up the play. And he drew up the play. I go, dang, that's pretty good. That's pretty good. We called the play just before halftime, and it scored. And he starts hitting his wife, and he's going, that's my play. That's my play. And she's going, yeah, right. Yeah, sure it is. And that, we'll take it from anywhere.
We'll take it from anywhere. This is a guy that, one, obviously is all about the results. He doesn't care where he gets his information. He just cares about the end result. The other thing I learned from Coach Reid about this is he's so approachable. I mean, I've sat in meetings, the pre-game meeting where you're standing there with the coaches and the referees and the medical team, and you're going over kind of, okay, well, this is where the crash cart is. This is all the important things. Some of the coaches in the NFL, I was afraid to even look at them. So for him to be approachable by the janitor and say, hey, I have this idea for you, Coach Reid. You've been in the industry for 40 years. I clean the facility, but I know for him to be approachable, I think says a lot about him. We wanted to build a community where ideas are celebrated, a community where we got together and talked about patients. As we saw from Ms. Call, sometimes a patient isn't just super straightforward and have a very easy answer. Sometimes we have to get together and talk about these patients. The other thing we wanted to create is a practice that celebrates innovation. If you haven't seen the movie Apollo 13, I think that's the second piece of homework. But they have an explosion on the spaceship. They lose oxygen supply, and they go into the lunar landing module as their kind of life raft to hover around in space. And the carbon dioxide levels are starting to rise. And unfortunately, the main module carbon dioxide machine doesn't fit the lunar module landing one. And so they have to innovate a solution to save these astronauts' lives.
We have a situation brewing with carbon dioxide.
We had a CO2 filter problem on the lunar module.
5 filters on the limb.
Which were meant for 2 guys for a day and a half. So I told the doc,
You're already up to 8 on the gauges. Anything over 15, you get impaired judgment, blackouts, the beginnings of brain asphyxia.
What about the scrubbers on the command module?
they take square cartridges.
The ones on the limb are round.
Tell me this isn't a government operation.
It just isn't a contingency we've remotely looked at.
Those CO2 levels are going to be getting toxic.
Well, I suggest you gentlemen invent a way to put a square peg in a round hole. Rapidly.
Okay, people, listen up. People upstairs handed us this one, and we gotta come through. We gotta find a way to make this fit into the hole for this, using nothing but that. Let's get it organized.
Okay, let's build a filter.
Better get some coffee going too, someone.
And sometimes in business and in our practices, we literally have to get together and figure out how to put a square peg into a round hole and innovate, and sometimes do it rather quickly. One of the ways that at Summit, we tried to reinforce these concepts of innovation and building a community and getting the right team together is something that we call Grand Rounds. So every Tuesday, this is a doctored photo. Like you could show up at 7:10 at this room every Tuesday, with the exception of Christmas Eve, but for 4 years, every Tuesday, this is exactly what it looks like. We have healthcare professionals that are getting together and they're discussing patient cases. I'm glad Ms. Call talked about getting together and working through things and discussing cases, because this is exactly what we do every Tuesday. These are the specialties of the providers that are frequently there. In any given Grand Rounds, there's over half of those specialties represented, and we talk about the case. And I learn so much from everyone else's perspective. I am a much better surgeon because of the physical therapist, occupational therapist. And so my point from Coach Reed is not that we consider them the janitors, but that these are, like, if the wisdom of crowds is better than the wisdom of the expert, what about the wisdom of experts? And that's what we've tried to create here. We made an annual conference, again, mid-COVID, and we invested just shy of $100,000 to put this conference on. I think, my staff doesn't know that I know this, but some of them were like placing bets on whether this was just gonna be a complete disaster. And that's fair. It's the middle of COVID. We didn't even know if Sundance was gonna shut us down. But we put it on. This is a picture from our conference this last year. We are an official Orthopedic Research Society sponsor or sanctioned event, so you can come present your research here. We had 350 credentialed providers show up. We had a provider that came the first year, sat there and was like, when we first started this, I was like, I am not sharing my industry secrets with all of these people. These are all my competitors here. Why would I do that? But after sitting through the conference and learning from other people and seeing how the collective healthcare of the community was being elevated, he's one of our fiercest supporters now. Really quickly, if I had to summarize in one picture kind of everything that I've been talking about, shoot. This is Richard. Don't worry, I have his permission to talk about him too. He's a truck driver for 38 years, and he tripped in his truck and ruptured both of his quad tendons. He's unable, obviously, to move or walk, and he got stuck in his car overnight, and neighbors helped him into his bed the next morning, and from sitting around and not being able to move, he developed blood clots in his legs that traveled to his lungs, and he had a cardiac arrest from a pulmonary embolism. And literally 16 months ago, paramedics were pounding on his chest, trying to keep his heart beating. It's dusty in here. Someone say something. As he raced to the hospital. This is him 16 months later. Obviously had paramedics, emergency medicine physicians, physical therapists, occupational therapists, social worker. I mean, there's so much that goes into this. There's no book on how to treat this guy. I mean, do you cut someone open that's on blood thinners so powerful that like it's dissolving the clot in his chest? And like, what's the timing for that? There's no book on that. This was for Carolyn and I, hundreds of conversations, lots of thoughts. We put together a plan. We operated on him, and he walked into my clinic, proudly presented his CDL physical fitness test that he had passed, where he has to climb in and out of the truck, get underneath it, and crawl around. And so we've tried to make our practice about the patients. We've tried to surround ourselves with the right people. this was definitely the right person for me. Carolyn is awesome. She is freakishly strong. The other day in surgery, I couldn't untwist something. This alleged tough guy hockey player, scrub tech, couldn't untwist something. And Carolyn was like, let me see it, boys. And she grabbed it and she just went like that. And I was like, well, I loosened it for sure. But she is absolutely 100%, I mean, among a lot of people, the right person for my team. She has 20 years of experience in an emergency medicine department. She just knows so many things that I don't know, and I can trust her. Just yesterday, we had a component for a shoulder replacement be calibrated incorrectly. And I was like, Carolyn, you fix this. Because I had to keep going with the surgery, and she just went on the back table, she figured it out, she got it all recalibrated. And I was like, are we good? And she said, we're good. And if Carolyn says we're good, we're good. And so I put the component in, drilled the screw, which is kind of the point of no return, and our x-ray after surgery was perfect. We also, I think, have brought together a community. There's so many people that went into taking care of this patient, and I think we've tried to be innovative. We've gone from a practice, I'm running out of time, but I've gone from a practice of basically scheduling no one for surgery. I think I was in the path of totality for longer than a few moments. I think I was in the path of totality for 3 months. Scheduled my first patient, walked out, and the office just erupted in cheers. And I was like, guys, we gotta act like we've been here before. We put together an amazing team. You know, we're gonna do over 500 cases this year. It's been an incredible journey. And we've been able to also help some people along the way. Carson, there in the back, we've sent, Carson's gonna start PA school. He's in this picture. We've sent 15 students to next level education, whether that be PA school, med school. We've taken on 21 residents. We've even taken on one super awesome high school intern. So it's been an absolute joy, and thank you so much.